Welcome to MOH Essentials. Indications for compression treatment in chronic venous disorders. These indications are based on the current guidelines and on our consensus document. In chronic venous disorders, venous leg ulcers are one of the best studied indications for compression treatment. We recommend the use of compression stockings to reduce the recurrence of venous leg ulcers. And we recommend the use of compression treatment to improve venous leg ulcer healing. In addition, we recommend compression treatment to reduce pain in patients with venous leg ulcers. In the European Society of Vascular Surgery guidelines, the compression treatment with compression stockings is also recommended for the prevention of venous leg ulcer recurrence after healing. This recommendation is based also on a study of Clark-Maloney. They compared Class 1 and Class 2 compression stockings for prevention of leg ulcer recurrence. And they could show that people who were compliant with compression treatment had the lowest recurrence rates, about 8 to 10% in 1 year. In total, 11 study patients did not adhere to wearing the prescribed compression stockings, and of those, 7, which is 64% of the population, developed new ulcers within the 12 months follow-up period. The ESVS guidelines recommend compression for healing of venous leg ulcers, and they recommend to use compression bandages or adjustable compression devices. In addition, the ESVS guidelines recommend to use ulcer compression stockings, which are 2-layer compression stockings in the treatment of venous leg ulcers. This is also the recommendation of the German guidelines for compression treatment. Another indication is compression treatment after venous interventions, especially stripping operations, thermal ablation, and sclerotherapy. We recommend the use of compression treatment in the initial phase after the interventions to reduce postoperative side effects, especially pain, bleeding, swelling, and feeling of heaviness, for instance. The beneficial effect in the first week after interventions is very well documented, and especially in the first week, a good compression should be applied. We also recommend the additional use of eccentric compression to enhance the effectiveness of compression treatment and reducing postoperative side effects. The prolonged use of compression treatment, longer at the initial phase, should be used in patients with ongoing chronic venous insufficiency symptoms or signs. That means the limitation to the initial phase is only for the post-interventional side effects, like pain, after the intervention. But for patients who have ongoing chronic venous insufficiency, healed ulcers, or skin changes, the compression treatment should go on even after the initial phase. The use of compression treatment after liquid sclerotherapy, especially in spider veins and reticular veins, is also recommended to achieve a better outcome. The ESVS guidelines recommend compression treatment after sclerotherapy and after thermal ablation, and especially after surgery of varicose veins, especially after high ligation and stripping of the great and small saphenous vein. The duration of compression treatment after the intervention should be tailored individually concerning the patient's needs and post-interventional symptoms. In the American guidelines, compression treatment after interventions is recommended for at least 1 week. Thank you very much for listening. It was a pleasure to having you here.